Well, North Carolina ranks as one of the worst states when it comes to health care access for women and children. That's according to studies like one that's now being worked on by United Healthcare and East Carolina University to close those gaps. Our Ford Sanders joins us in the studio this morning with a deeper look at what's being done to help these two groups. Ford, good morning.
Good morning, Julianne. Through a $1.25 million project between UHC and ECU's Brody School of Medicine, officials hope to be able to help bring about better specialized care to those who need it.
Basically, people can get access to what science has promised them.
North Carolina ranks as one of the worst states when looking at infant and maternal mortality rates. Now, United Healthcare and East Carolina University are teaming up to bring about change for these groups.
What we saw in COVID is where there were already disparities and already concerns regarding health outcomes, especially in the communities that are most vulnerable, that those rates escalated.
Dr. Michelle Buckner is the Chief Medical Officer for UHC in North Carolina. She says when it comes to access to specialized care that is necessary, that's where the state is lacking.
It's really important when a woman does have a higher risk pregnancy to see those maternal fetal specialists. If you have to take a 3-hour trip and transportation is a challenge for you, it's likely you're going to not be able to access that specialty care.
So when her team saw that ECU already had their own project called the NC STEP program, that's when they felt a partnership was necessary, making the Mothers Project.
We build a relationship with a primary OBGYN clinic in a rural site, and we bring maternal fetal specialists to them via telehealth.
Dr. Sai Saeed is a professor and chair for ECU's Department of Psychiatry. He notes the model that they've designed can be applied to many groups like that of women and infants.
We have designed a model which is scalable, so we can start with one clinic, one hospital, or we can do a statewide, or we can do that nationally.
Saying that it's not only saved money and time, but lives as well.
We have seen 50,000 assessments so far in this program. We have prevented over 7,000 unnecessary hospitalization. That in itself is a saving to the state in excess of $40 million.
And both tell me that they look forward to how they can scale this project up for future studies, noting that right now their main focus is to make sure women and infant morbidity and mortality rates, along with food insecurity and other issues, are dealt with. For now, in the studio, Ford Sanders, 9 on your side.